This particular study grew out of an interest in thinking about, is the way that surgeons communicate a probability of something, the way they communicate risk, how does that impact patients' interpretations of it? And is there differences in the different ways people communicate risk? And, that grew out of observations that a number of us just had in our clinical practice, working with different people and seeing how, one doctor might screen a complication as being uncommon. Someone else might say there's a 2% chance of that. This study that we're presenting at the American College of Surgeons meeting is a really focused look at applying some of these different risk communication techniques that have been studied in other fields like psychology and fields dedicated to risk communication, but really applying them to a specific scenario in surgery and seeing how that impacts people's interpretations. What we showed with this study is that when you change the way those things are communicated, when you give someone for the same complication a different label of probability, either something that's verbal or something that's quantitative, you get huge changes in what they interpret from that. So I'll give you that example, the complication of a deep space infection. In the study, we tested telling people that happened 3% of the time, that it happened 1 to 5% of the time, or that it was an uncommon complication. And we then asked people to say, what do you think the risk would be for a typical person of suffering this complication, given the information you had? And you'd expect, and we saw that if I told you there's a 3% risk, most people estimated around a 3 to 5% risk. If I gave you that range, most of the estimates were within that range. When we told people it was uncommon, the average risk estimate they gave was actually 26%, and it was a huge range spanning many different estimates. So the variability in that interpretation was much higher. So that tells us that that type of communication is problematic because it leads to huge variation. And what the surgeon thinks they're communicating to the patient might not actually be what the patient is understanding. The first key takeaway from the study for me for practicing surgeons is just the simple fact that the way we communicate risk impacts how patients perceive it, which I don't think is necessarily a well appreciated fact. Is not something that's commonly taught in medical school, how to communicate risks and benefits and things like that. So to me, that would be the first thing, is just recognize that the language you use, the technique you use to communicate impacts people's understanding, and downstream can actually impact their decision-making because of that. There's been studies in other fields that show, for example, when you use those verbal descriptors and you get these inaccurate risk perceptions, it actually changes what people decide to do ultimately, which is really important.